Hi, my name is Andy Catcher at NOFAS, and welcome to this edition of the NOFAS webinar series at the National Organization on Fetal Alcohol Syndrome. My name is Andy Catcher. I'm the media producer at NOFAS, and we have a great webinar scheduled for you today with called Mobilizing the FASD Community to Take Action, presented by Sara Messelt, the Executive Director of MOFAS, the Minnesota Organization on Fetal Alcohol Syndrome. And this webinar is going to provide a lot of information about mobilizing community members, taking action, grassroots organizing, and all of that sort of great stuff on the local level and others. And just a brief background on the presenter. Sara Messelt is the Executive Director, again, of MOFAS, and she's been with that organization for 15 years. And she's worked with the board, staff, and the FASD community in Minnesota, creating legislation to improve the lives of people with FASD. Prior to coming to MOFAS, she was worked at the March of Dimes and is a graduate of the University of Minnesota. And MOFAS was the first charter member of the NOFAS affiliate network. And MOFAS is really a leading FASD organization in America, and their influence on the field of FASD professionally and their influence as far as helping people, families living with FASD definitely extends well beyond the borders of Minnesota. It's really national and some international influence really on the field of FASD. So it's great to have them participating in this webinar. And with that, I'm about to turn it over. Actually, just before I get to that, though, I just want to remind everyone to, if you have questions, after the conclusion of the presentation, there'll be an opportunity for Sara to respond to questions. So you'll see a little window on your screen, and you can type in a question at any time. And we actually encourage you to go ahead and type in your question as soon as it comes to you, because sometimes, depending on the timing, we may not have time to get to every question during this 1 hour allotted webinar. So the best chance that you have for your question to definitely get answered today is to type it in as soon as possible. And any additional questions will be emailed to Sara as well if we don't have time to get to those. So yeah, definitely feel free to type in your question anytime. Also, the webinar will be recorded, and a recording of the webinar will be available on the NOFAS website within 24 hours after the conclusion of the webinar. You can find that by going to our website, nofas.org, and there's a button labeled webinars. It's one of the menu items, and it'll be there. It'll also be on the NOFAS social media pages on Facebook and Twitter, and so that's the best way to find the video recording of this webinar after the conclusion. So with that, I'll turn it over to Sara.
Thank you, Andy. I am just absolutely delighted to be here and am marveling at the idea that we can all be connected and be able to learn in these amazing ways with this webinar. And I think that as a field, I'm encouraged to think about the fact that there are so many ways that we could be mobilizing our communities as we begin to really move into a world of really a global world in terms of being connected. As Andy said, I am with the Minnesota Organization on Fetal Alcohol Syndrome, and I am here today to share a few bits of knowledge of what we've learned here at MOFAS. And the title of my presentation is Mobilizing the FASD Community to Take Action. And I am very interested to have your questions and to continue this dialogue, really looking at this as a starting point and to continue this dialogue as we all really work together to mobilize our community and make the changes that we need to see. Real briefly, here at MOFAS, our mission since the organization began is to eliminate disability caused by alcohol consumption during pregnancy and to improve the quality of life for those living with FASD throughout Minnesota. Our vision is a world in which women don't drink when they're pregnant and people living with FASD are identified, supported, and valued. And that piece of being valued really is embedded in this advocacy work. And we feel very strongly that we will not achieve our mission unless we really achieve our advocacy objectives. Today, we're really going to look at 3 areas that I hope you will leave the webinar feeling like you have additional information on. First of all, I really want to define for you advocacy and understand the role of public policy in making change in the FASD community. I also hope that you will go away having learned about our multi-tiered approach for developing a strong public policy program in your community. This is the approach we came up with. Advocacy, one size does not fit all, but I just want to share our successes and our failures because we've had plenty of those. I also want to explore possible legislative proposals that will move the FASD agenda forward. Well, first we might really need to go back to the very beginning and say, why do we need to mobilize? And I think this quote from Margaret Mead really sums it up, and I'm sure many of you have heard this quote: "Never doubt that a small group of concerned citizens can change the world. Indeed, it's the only thing that ever has." And I think if you look around and you see people having what they need, having fairness and justice in the world, people having a positive life and access to everything that they need to have a healthy and productive life, you will see that there has been some powerful advocacy work that has happened. So my question specifically, as we begin to explore this, is why do we need to mobilize the FASD community? I mean, we know we need to get people educated. We know we need to have people know there's no safe level of alcohol to drink when they're pregnant. We know that people living with FASD need to have access to diagnostic services and supports. But that really looks more like education and services. So what is this about mobilizing? And I think that it boils down to these are some touch points that I think really drive me personally, but also drive our board of directors in our advocacy community. I think one of the big challenges that faces our field is in the area of stigma. And I think that there is stigma related to who we perceive as who is drinking when they're pregnant. I think there is stigma attached to people that are living with this challenge, living with FASD, diagnosed or undiagnosed. And I really think that stigma is a huge barrier that resonates in so many areas in the areas that in us trying to move the field forward. I think human rights is another big area that really is a touch point in terms of why we need to mobilize. This year marks the 25th anniversary of the Americans for Disabilities Act, and I would really challenge all of us in the field, in the FASD field, to really analyze and really look through that lens and say, have people living with an FASD, are they realizing the promises made in the American for Disabilities Act? Do we have a seat at the table? Are the needs of people living with this disability really front and center and a part of the conversation? At least for MOFAS, we knew that if we wanted to achieve our mission as a statewide organization, that we had to be engaged in advocacy work. We had to be engaged in systems change work. We knew that we could go and educate every kid in every high school. We could go to every health fair. We could go and do all of these different activities, but that unless we start looking at how people with FASD intersect with systems that are in place to support people, we would never truly achieve our mission. Then fourth, creating change for people living with an FASD. It just kind of says what I've been saying in a different way, but that is very, very, very important, I think, in that we actually move the stigma aside, look at the human rights related to what people with an FASD deserve and need, and that changes starts happening in community by community and state by state, and hopefully eventually throughout our nation and the world. And also, and as many of you I know care as much about people living with the disability, we also want to create societal change for alcohol-free pregnancies. And so in some regards, we have a whole huge another area that we need to make sure that we are actively engaged in as it relates to what policies and programs are in place to help support alcohol-free pregnancies. I think it's really important before you embark on a mobilization campaign that you really look at how this can really resonate with people. I think we have to make this very real for people because there's a disconnect between why we should be involved in this work and what difference is it really going to make for me. I want you to take a quick look at these three little vignettes and stories. The first is the caregivers of a child with an FASD object to the school's classification of emotional and behavior disorders and advocates for services under other health disabilities, and the school rejects that request. What do you do? Secondly, an adult with a suspected prenatal alcohol exposure is seeking access to diagnostic services, but is unable to access FASD diagnostic services. That's very common, I'm sure, in your state. It's very, very common in our state as well. A 29-year-old woman with a documented disability wants to move in with friends, and her parents want her to remain in a group home, supervised and protected. The parents seek guardianship to compel the young woman to remain in a group home. Now, all of these can be a little bit controversial, but I think why I'm sharing these little vignettes with you is to see that if we have the world in a place where we want the world to be, and that is with justice for everyone living with an FASD, that these are in fact all of these touch the areas of advocacy. These all have underneath them rules and policies and laws that can help to address these issues in a proactive way. It's really important to understand the essentials of the advocacy process. It's really important that people, first of all, are aware of their rights. What are my rights? And that can vary greatly between community to community, but there are some very basic rights that people living with a disability, in fact, have. It's also important that people do some individual reflection and that there's an awareness of self. There's awareness as a caregiver of someone with an FASD. What are my rights and what are the things that I should be aware of that I need and that my family needs to be healthy? And once you start having people be aware of both their rights and how that applies to themselves, that's when they become motivated for organized action. At MOFAS, we really have designed our public policy and advocacy work around 5 kind of buckets of area and work. And the rest of the webinar will be focused on these 5 areas or these 5 components. First of all, policy change priorities. That's what are we actually trying to change? What are our priorities as a field, as a state, as a community? I'm going to give you some tools about how to actually analyze that. You need to also be looking at developing advocacy network. Who are your soldiers that you want to have in your army, that you need in your army? I'm going to talk about collaboration. Who should we work with to move our agenda forward? Strategically, who does it make sense for us to work with, and who maybe does it make sense for us to not work with? Communications. It's very, very, very important to have a very focused communication message as we move into the world of advocacy. And then the 5th area I have called events for exposure. Advocacy, mobilizing our community really is about creating awareness, and that can happen on many different levels with large and small events, and I'll give you some tips and insights into all the different types of events that can help mobilize your community and move your agenda forward. First of all, policy change priorities. You really need to think long and hard about what is your highest priority. And to do that, I don't think you can take one step forward without engaging people with an FASD and their families. Policy priorities should not be made by somebody sitting in office saying, this is what I think that these people need. That is completely counterintuitive to what needs to happen when building and mobilizing a community. People that are living with an FASD, their caregivers, their families need to be front and center in this dialogue. And you can do that in lots of different ways. You can do that, and I'm sure many of you do that already, but you really need to find out what are the barriers that you have to achieving the kind of life that you want to have. We have, on a very practical level, have had a lot of success by using things like surveys, one-on-one discussions on the phone and in person, small focus groups. And I really encourage you not just to talk to parents and caregivers, but also to engage people that are living with this disability and to learn firsthand from them to what their challenges are. One thing that we have done a lot of in Minnesota is really analyze the autism community and the success that they have had. I think that we feel that as far as really advocating for policy changes that have made people living with autism on the autism spectrum more successful and having a real well-rounded life, we look to them and we really analyze where their successes have been. One of the things that I did a few years ago was actually go to all the laws on the books in Minnesota, and I did a search for autism. And everywhere there was the word that came up with autism, I looked at that law and started to look and see if that law could be applied to people living with an FASD too. I'm not saying that the needs are exactly the same by any stretch of the imagination. I truly understand that it's not just, there's other very specific issues, but I think it helped to create a bit of a map, and it was an opportunity for us to analyze where was this field that has been very successful in creating good change. Where were some of the steps that they took? Where were the openings that they had to be able to really move their agenda forward? Other things to look at in the policy change priorities is to really make sure that you approach this in a bipartisan way. We have worked very hard to educate legislators, both Republicans and Democrats, and quite frankly, we have felt that this issue has appealed very, very well with both groups, because conservative people that have a conservative leaning approach understand the financial benefits for helping to prevent FASD and to make sure that the services that we are providing for people are actually meeting their needs. And then we also find people that have a more progressive agenda look at this very much as a social justice issue and really understand that until everyone has what they need, that our work is not done. Another thing that we did when we first got going was to really identify that low-hanging fruit. There are many, many, and again, that's going back and looking at some of the autism work that's been done. It's looking at where there has been a widening of rules and laws around people gaining access. So really look at where there might be some simple gains that you could do as a community that will add confidence to you and will add confidence to your advocates, because people get very, very motivated when they see that there are successes. I would encourage you to start looking at legislation that does not even have a fiscal note. Look at a strategy or a policy that you can promote and that you can push that is not asking necessarily for a whole lot of financial resources, but a policy change that would in fact help make a difference for people but would not require additional funding. We look at other states. We beg, borrow, and steal and look at other states and learn what has been successful. Every time I meet with a legislator in the state of Minnesota, they say to me, well, what are other states doing about this issue? And so I think it's really important to look at other states and what other states are doing that is very successful. Another question that you should ask yourself is, because it truly helps to have some good friends who really understand this, And so are there some policymakers right now that are current elected officials in your community, a county commissioner, a school board member, or on the state level, a state legislature, who has a strong commitment to an issue like this or similar ones? I also would really encourage you to look at newly elected officials, because oftentimes they don't have their high priorities identified yet, and they're looking for something to really make their own and really say, this is something that I am very proud of and that I want to really become considered an expert on with my colleagues. This year, one of the youngest members, newly elected, and one of the youngest members of our state legislature was the chief author for us on legislation that requires paraprofessionals to all be trained if they are assigned to a child in the school that has FASD, that they are required now to have training. And that was, our chief author was actually, like I said, a very young person who was very receptive to our call and our ask, because he didn't have as many people pounding on his door asking him to author legislation. I would encourage you to select maybe 1 or 2 items for your agenda. And it is really important, once you dive into this field, to realize that you are going to be bombarded with people that want you to be engaged in their work. They want your advocates to advocate for their work. They are interested in collaborating with you, and I really encourage you to find 1 or 2 things that really speak to the FASD community, and really hone those and stay on message with those. But realize that it's a very fluid process, and so we have a 3-point way to really evaluate, as we are asked to be involved in all of these different promoting different pieces of legislation. The questions we ask is, should we lead this legislation? Should we lead the effort on this piece of legislation? So when we were advocating for paraprofessionals to have FASD training, if they were assigned to a child with an FASD, you bet we were going to be the lead on that, because we wanted to be front and center to say this is very, very, very important for a child with FASD success in the school, and we wanted to really be on front and center on that. If we're not in the lead, someone say, the second question to ask is, should we support this but not lead it? One of the pieces of legislation that was introduced this year in the Minnesota legislature was about decreasing the amount that parents have to pay for parental fees when they qualify for medical assistance. Now, we weren't in a position to lead that fight, but it certainly is something that impacts our families greatly, and so we actually supported that legislation. We encouraged our advocates to write letters about it and to come to hearings and to speak to their legislators about it, but we weren't the lead organizers on that. And then the third question that you ask when you're confronted with a piece of potential legislation, or should we oppose this legislation? Should we actively oppose this legislation? An example of that for us in Minnesota was related to criminalizing the use of alcohol use during pregnancy. We were very opposed to that, and made sure that people knew that, in fact, that was something that our organization felt very strongly that was not good in any way, shape, or form. Here are a few examples from Minnesota of things that we have been successful with, and that are actual pieces of legislation that we have been able to move forward, and may get your wheels thinking about something that could be, again, some low-hanging fruit that could be a place for you to start. Probably our greatest achievement is that in 2004 we were able to get designated funding from the state with a state appropriation for FASD prevention, diagnosis, and treatment. And that's been a big part of why we've been able to achieve what we've been able to achieve. This money is in the base budget, And that is an important distinction, and every state works very differently. But if it is in the base budget, that means that it is in there kind of in, you know, from here on out, and that every year you don't have to go back and ask every year if you can have this funding. Another example of a piece of legislation that we were successful at is that we changed our mandated reporting legislation for women who were seeking prenatal care, who were admitting that they had drank during pregnancy. Previously, if a prenatal care provider was told by their patient that they were drinking or using marijuana during pregnancy, that provider was obligated to call child protection and report that woman for that. We were successful in creating a loophole that allows prenatal care health providers to not have to do that if they feel that the woman is complying with prenatal care, if she's committed to having a healthy baby. That we felt that that was actually, the previous law was actually deterring a woman from, deterring her from coming into prenatal care and making her avoid it if she felt like she couldn't be honest with her provider. As I mentioned in the previous slide, we've opposed criminalization of drinking while pregnant. We were successful about 5 years ago that in the Minnesota state definition of disability, that we were successful at getting fetal alcohol spectrum disorder included as part of that disability. Again, this costs nobody anything, but it's language change that has a very powerful punch in terms of being able to advocate for services that we need. And as I previously mentioned, we just were successful in requiring training for school-based teachers, aides, paraprofessionals on FASD. The next area that I want to talk about is developing an advocate network. I really want you to start thinking about your work as grassroots, but also grass tops. Grassroots, I think, is something that you're all probably really familiar with. That is the rank and file, front and center, boots on the ground people that are out there, that care about the issue, and that are some way and shaped, either personally or professionally, probably impacted by prenatal alcohol exposure or FASD. I really encourage you to think about grass tops also, and that's where I talk about finding those champions. We have been so fortunate in Minnesota that we had the former First Lady of Minnesota, Susan Carlson, who really founded MOFAS, made the connection with NOFAS, became the first state affiliate, and she really used her power and her position as the First Lady to bring this issue to the fore. And so that has been, you know, obviously one of our best grass tops champions that we've been so fortunate to have. But there's other people in every community that, and in every state, that can play that role as well in terms of really becoming your spokesperson and becoming your champion. I would encourage you to engage a smaller group of volunteers to start. And our success, of course, and I think the success of many successful mobilization campaigns is involving caregivers and people with an FASD. Another very practical thing, information is power. I cannot tell you the most important thing is to find a system to organize the information that you have about people, and it really can just be a simple spreadsheet. There's lots and lots of databases and tools out there that you know, are designed for mobilizing communities and campaigns and political campaigns and mobilization campaigns, but really anything will work as long as someone keeps track of the information. It is so powerful if we have a piece of legislation that's in our state legislature that's going to be introduced in a committee, and I can go and look on a spreadsheet and find out the committee members that are maybe sitting on the fence, and I can say, oh, I've got the Byer family, I've got the Anderson family, and I've got the Ford family all living in this person's district. I'm going to make sure that those three families reach out to that legislator before he or she walks into their committee room and say, this is really important to my family and here's why. You cannot underestimate the power of an individual who's impacted by this disability connecting with a legislator to say, this is not something that happens in other people's communities. This is something that happens in our community, the community that you represent and the community that I live in. And so let's work together to seek that change. But that all gets back to having a really good system in place that tracks who is interested in being on your network, where do they live, and what level of involvement are they interested in doing. And if any of you want some of our tools, I'm happy to email those to you after the webinar. Really, to create your advocacy network, you need to do 3 simple things. You need to recruit them, you need to recruit folks, you need to engage them and empower them. Recruiting people is, it's something that I think is really embedded in the idea of common sense. It is asking people, will you help being involved in this? Will you help being involved in this issue? Will you become a part of our FASD network here, Network for Change here in our state or in our community? You need to ask people directly to say, there's many different levels of ways that you can be involved, but if we need you, would you be willing to be, we called them, when we first started our campaign, we called them noisemakers, and you're free to use that term if you want, but will you be an FASD noisemaker? Will you be part of a network that lets our elected officials know that FASD is a real issue that thousands of our citizens are dealing with in this state? Once you recruit folks and you're keeping track of them, you need to educate them about the issues. Everybody comes to an advocacy network with their life experience, which is the most powerful and important part of motivating and engaging people. But we need to move forward with that passion in a way that's going to impact legislators. There's nothing that turns off legislators more than somebody talking too long or over or going on and on and on and on and on. There's an effective way to get our point across, and so we really need to educate people. And again, getting back to that 1 or 2 priorities, keep people on point, keep people, and I'll give you some examples of the way that we've done that in Minnesota, but really encourage people, say, yep, you can have lots of other concerns and issues, but we're going to really focus on this issue this year. And once we get this one done, then we're going to tackle this one. And again, making sure people feel like they have a voice and that you're hearing their ideas, but at the same time, kind of really making sure that you keep them focused on the eyes on the prize. You need to engage people, and as I said, keep them focused and make sure that they're telling a compelling story. And then empowering. I think that's where the whole piece comes in, where we start talking about human rights and start saying we have individuals that are living in our communities that don't have the same level of access to health and happiness that some of the rest of us do, because there's barriers that we need to work together to remove. Here's some things to consider. I'm going to start at the bottom. Start with your base. Your base are people that care about this issue, and again, I get back to our amazing families and people living with this challenge. I think that people that have struggled with this issue for years, I have talked to many, many families over the years, and they all will say, if I know that something that I can do can help another family not have to go through what I have gone through, I am completely on your team. And so I think you really need to start with that base and that network of people that you know that have already been fighting this fight as an individual in their community, and oftentimes are very willing and receptive to join a network. I can't talk enough about training people, and again, giving them good tools to be able to really articulate and tell their message. I often also will say to you that we have had a lot of great support in our community by collaborating with other disability organizations, often that have more advanced networks than we do, that have amazing tools. We work with the ARC in Minnesota, we've worked with the Coalition for Citizens with Disabilities, and they often will provide the training on how to be an effective advocate, and you really just have to wrap it in that FASD package, but they are oftentimes very willing to come and help to train advocates to learn how to navigate the policy systems. Once you start with your families, that's great, but work to try and get broad representation of all types of advocates. Make sure that you have birth and kinship families, that you have foster and adoptive families, that you have people living with an FASD, that you have people that represent really a broad constituency. So in fact, legislators don't pigeonhole this and don't say, well, this is something that just happens in that community over there, but it doesn't happen in my community. And like I said before, make sure you keep focused on your identified issues. Now a little word about Grasstops. That's what I was talking about before, identifying that champion. Here are some more tips on that. Can you identify a high-profile champion who can open doors? That is sometimes really difficult, and it's hard because of that stigma that exists. It's not like necessarily saying, gosh, will you lead our cancer campaign, or will you lead our campaign for something that has a broader understanding and has become less stigmatized. So you're asking someone that is really very motivated on this issue, and you may have to do some good education to identify that champion. Like I said before, look at the legislative track record. Is there someone who's done a lot of work and contributed really well to the autism community, or possibly to the disability community in general? So look at who has been the chief author on some legislation, and when your legislature is not in session, ask if you can stop in and talk to that legislator and say, we are really looking for someone that can help really be identified as a leader in this area in our legislature, or again, apply it to your community, on our school board, in our communities. Look to your families. Do you have a family who can be a natural spokesperson and can bring attention to the issue, that can be interviewed? I think that oftentimes a parent or an individual standing up and saying, I am living with this every single day, that just speeds you ahead 1,000 miles in terms of the respect that brings, and the awareness that brings. And again, one more time, I can't say it enough, make sure that you just don't identify all of your champions with one party. Okay, so organizing the Army. What are we looking here to do? I had someone, a very great advocate in Minnesota, say to me, okay, you've gathered the Army, now you need to tell them what to do. And I think that was very, very wise advice, and it really got me to thinking, we can't just bring these people together every year at our day at the Capitol, or we can't just say, great, you're on our advocacy network. Now it gets back to that thing of engagement. We really need to have people become a part of responding and educating. It's really about responding and educating. So I'm going to start at the lower left-hand corner here, and that is, I would really encourage you, as part of a training and as part of how you engage with people, and again, it could be done in a webinar format, have each advocate work on their story. Have them actually write down what is the point that they want to get across with their story. And I don't have time in this webinar, but there are actual apps that you can use. We have one through the Minnesota Citizens for Disabilities. It's an app that you can use to help people tell their story. And there are many tools that you can use that are really good to help you structure it, and especially if you have maybe you are a person with an FASD that is impacted by, not having good cues as far as verbal skills. It's really important to make sure that people living with an FASD that go to their legislature and are telling their story and are brave enough to tell their story, that we work closely to make sure that we do everything we can to have that story be powerful. And that's by really practicing it and honing it in to make sure you're articulate and that you make your point. And again, that you don't go on and on and on and on. Oftentimes legislators have less than 5 minutes with you, and so you have to quickly get to the point. The second thing I would, after they kind of write their whole story down or tell their whole story, practice telling your story and advocating for a specific policy or legislation. So what we do at our training is that we have people actually sit down and write their story, and then we have our legislation or potential legislation, and we ask every advocate to pick one of those pieces of legislation that resonates the most with them, and have them draw the connection between this was my struggle and this is a piece of legislation that could help to alleviate that struggle. So for example, getting back to the training of paraprofessionals, a young man who had lots and lots of trouble at school, was expelled, was constantly failing at school. He told his story on that, and he talked about having a paraprofessional that actually understood his disability and his unique challenges. And so he was able to really draw an absolutely amazing, powerful connection in terms of showing if every child or teenager that has this disability had a paraprofessional working with them that really understood the unique challenges of FASD, look at all of the pain that we could have avoided. Look at how this young man could have been successful and was successful because of that person. So you want to link it. You don't want to just go on and on and on about your story and not link it. Bring people together to train them if time and money permits. And know that you can make an impact on the federal, state, county, city, or school board level. So when I'm talking a lot about our state legislature, but these tenets, these ideas that I'm sharing with you really resonate on how and whatever area you are trying to make an impact on. And policy is made at all of those levels: school board policy, county policy on how people can gain access to waivers or what the rules are around getting respite care for families. Those are county-based decisions, and so you can be involved and make a huge difference on the county level, and I'm sure that varies greatly from state to state. The state level and on the federal level, and NOFAS really is our network for creating that national presence and bringing together all of the state affiliates to really have a unified voice as we reach out to our elected officials on the national level. We love doing our day at the Capitol every year in St. Paul, Minnesota, and I would strongly encourage you to look at that opportunity if that is something that would work for you. As I said, part of building your advocacy network is to have opportunities for your advocates to meet with your legislator or your elected official. Here's a very simple slide, again reiterating what I said before. And there's lots of different tools and resources that like I said, that I'd be very happy to share with you. On our website, we have an example, a YouTube video, an example of someone meeting with their legislator and telling their story effectively. But it really is a very quick five-point plan, and that is: you introduce yourself, you identify the issue in which you're concerned. So obviously, I'd like to talk briefly about FASD. You briefly share how your life has been impacted, highlight a few impactful points that describe your family, keep the story to a few minutes, and then share your ideas for what would improve life for individuals and families living with FASD. And this is where you're specifically, you could specifically talk about a piece of legislation if that is what you have. And we say, leave asking for their support for a specific piece of legislation or policy change that you want, and thank the legislator for taking the time to meet with you and listen to your story. Another, back when I was talking about the 5 buckets that MOFAS works on, this is something that I just want to touch on briefly, and this is that piece of collaboration. I think, and this is a bit of a personal opinion, but I think that we really need to roll up our sleeves and keep the FASD voice strong. And I'm saying this at the same time that I believe that collaborating is the most important thing we can do. So I guess it's, it's not an either or, it's a both and, as they say. We need to keep our voice strong. We need to prove to the FASD community, to people living with FASD, to the families and caregivers, that FASD deserves a motivated network of people that are strongly advocating for policies and laws that will improve their life. And I think that there is a lot of opportunity to advocate and collaborate with other disability organizations, but I think that we need to challenge ourselves to pick 1 or 2 specific things that have the FASD name on them, because I think that that is going to, it's like a snowball. I think that that will embolden all of us to say, yes, this really does matter. We don't need to take a back seat to anybody. This is a real disability. This is something that we all need to be working on together, finding those opportunities to really advocate for change that is specifically going to impact a person living with FASD. Having said that, there is power in numbers and coalition building, and we have found in Minnesota, as we build our network, we become a very attractive organization to collaborate with, because people know that we have advocates that are passionate and that will respond to legislation or to other issues, and we want to share that and be part of a greater network of people. And so it's a real balancing act to kind of make sure we're pushing our agenda at the same time we're collaborating with others. And I have been absolutely blown away. I have been so humbled by when we ask for other disability organizations to help us. It has been amazing, the support that we have gotten from the Brain Injury Alliance, the ARC, the ARCs in Minnesota, the Autism Society of Minnesota, lots of organizations that have really joined hands and have realized that oftentimes FASD has been a little bit left out of the network, and so it has been a very rewarding thing to see that as we have built our network, that we have gained the support and respect of other advocacy organizations. And remember to analyze what you're being asked to work on from other groups. Again, getting back to that thing, should we be leading this? Should we be supporting it? Or should we be opposing it? I just have a few more slides here before I wrap up, and so I want to make sure I leave a little bit of time for your questions. Communications is very important. What we communicate, how we communicate as we talk to legislators, as we talk to our policies, our message should be focused. Never give a legislator or elected official anything that's more than 1 page. They won't read it. They won't look at it. It will end up in a central file somewhere, and keeping your point to 1 page is really important. Other communication techniques that are very important, write letters to the editor, excuse me, or pitch longer stories to your local press. Legislators and policymakers respond to what they see in the press. And when they know this is starting to be like a hot topic, it's like, did you know that 5,000 babies are born in Minnesota every year that have been prenatally exposed to alcohol, and that, we have very few diagnostic services in the state? It's like, oh my gosh, that's a real disparity there. And as we start telling that story to our press, our legislators and our policymakers become interested in that, because that's what they're elected to do. We work with our Capitol Press Corps. Make sure you understand who they are and where they are and how they can be support to you. They are always looking for good stories. They're always looking for who's leading the way on things. And so if you can become a good resource to them, they truly value that. And again, when you are doing interviews with radio and TV about your policy agenda, make sure you're prepared and focused. Always consider letters to the editor, email, and phone campaigns. Here's an example of a two-sided, and I'm cheating a little bit here when I say one page. This is a back-to-back, but we worked this year on getting additional resources for pregnant women that have chemical dependency issues. And so on the front page, you can see the bill was House File 974 and Senate File 948. On the front, we had three basic facts about the issue. We had the addressing the issue, how do we want to address this issue, and what's our recommendation. And we were recommending, MOFAS was recommending $2 million a year to continue expanding this model program to serve underserved regions in Minnesota. And then on the back side, we had a success story. So if the legislator was intrigued and we wanted to pull at their heartstrings and help them understand this was happening to real people, this was her story on the back side. And I'm happy to report we didn't get $2 million, but we did get an appropriation of $250,000, which was very exciting to help expand this program throughout the state of Minnesota. The last bucket that I'm going to talk about are events, and I will breeze through this. This events I will describe as anywhere where two or more are gathered to organize and be educated and mobilized around an issue that can bring exposure to the greater community. You can create higher profile events. They are a way to attract media. It's a powerful way to tell your story. It's a great way to fish for legislative champions. Many legislators like to be in front of a crowd, like to be in front of a group of people, and so if you invite them to come to your event, that's a great way to get them engaged, and then you have families start telling their stories, and it really can be very motivating. It also energizes our advocates. You can start small with home-based meet and greets. We have some very simple things that we do where we invite a legislator, not during this legislative session, but during off times, we invite a legislator to the home of a family living with FASD in their district, just to come over for a cup of coffee after dinner on a Tuesday night, include a couple other families or professionals, and then just casually visit with that legislator, telling stories of family members and asking the legislator ideas on how to create change for your child. It's a very, very powerful and potent activity to do. You can also hold a town hall meeting, or you can participate in other town hall meetings. Oftentimes legislators go back to their districts and they hold town hall meetings. They want to hear from their constituents. They want to hear from the people that can vote from them. This is a little bit of a larger project. You should select a free and accessible community site, such as a library, a church, or a school. Make sure that you have lots of advocates attend, and then invite 3 to 4 legislators, policy members, and ask them questions on their positions, have advocates tell their stories, and look for common ground. The last one I'll describe for you is a day at the Capitol, and this is something that we have done for 5 or 6 years here in Minnesota. This is a big project. This is a day that you hold. We have our FASD Day at the Capitol. And we have a goal of having at least 100 advocates that come to the Capitol in St. Paul on a designated day, and it's our day at the Capitol. We have a program or a rally with an agenda including legislators who support our work, advocates who can tell compelling stories, and then we give good instruction on policies and how to talk about them. We follow our rally with legislative appointments. So we have 100 advocates and sometimes more. This year I think we had close to 150 that come and participate in this rally / training session. And then we have appointments that we've set up for those advocates to go meet with their elected official from their home districts. And that's where we have our one-page handouts and where we work on people going and saying, I live in your district, I have a child with an FASD, and I want you to support legislation that would expand educational services for children like my son John and others children like him. We constantly are following up and thanking legislators and advocates. So in conclusion, I just want to encourage you to start small, but I also think that we as a field need to start dreaming big. There's strength in numbers, and as we grow local and state advocates, I know that we can contribute to a federal voice on this issue as well, and that people will know that this is not some low incidence disability that happens in other places, but that there will be real strength in numbers as we become organized as a field. FASD issues are real issues. These are real families, real individuals, and we do not have to take a back seat. Small, consistent steps over time creates major change. So it may seem daunting, but I will tell you, we started with a yellow legal notebook pad with 10 names of people that said, why don't we do something about this in Minnesota? And now we have about 600 people in our database that are willing to be a part of our network, be responders, be advocates, be community educators. And that's when we start really seeing change and people taking notice. But it wasn't that long ago that we just had that yellow notebook with names written on it. Federal legislation and funding, there's a piece of legislation called the Olmstead Act that is a whole nother webinar that probably many of you are aware of. These are all tools that we can be using in our local and our state work. So I encourage you to really jump in and begin to do this work. I am always excited and available to work with people on the phone and talk to people. I think this is something that we all have to really roll our sleeves and do. And I'm sure many of you have heard this over and over again, but this is a quote that I hold dear, and we really must do this together, and we really must be the change that we want to see in the world. And if we keep looking at other people to make the change that we need to for the FASD community, that is just that's not going to happen. It truly is up to us. So in closing, here's my email address, and you know how to get a hold of NOFAS. There's their phone numbers, and we truly are all in this together. So thank you so much for letting me share a little bit about our experience here in Minnesota. And like I said, if you have any questions, I know there's not much time left, but I'm more than happy to answer anything we can in the last few minutes.
Great. This is Andy at NOFAS. Thank you very much, Sarah. That was a great presentation. A lot of really useful information, very inspiring examples of the power that definitely can happen when people in the FASD community get involved, and that's really great. So thank you very much. We have just a few questions that have come in. One of them is if you could talk about, some person is wanting to know what are the best practices, or if there's concrete examples and practices for identifying like-minded decision makers to work with?
That's a good question. I think the best practice piece I'm not sure about, and I would guess that public policy departments at local universities, we have the Humphrey School of Management at the University of Minnesota that often is very willing and helpful in terms of some of those types of resources, and I would really encourage people to explore. We've had amazing interns that have been available in terms of being able to help do that analysis, graduate level interns that have been able to help do that analysis. So I think in terms of identifying like-minded folks, it really starts with some of those things that I said before. I just look at who's doing this really well, and then I just, blatantly follow in their footsteps. We have an impressive, as many of you probably do, an impressive autism community that's very well organized. And I think a big part of our challenge has been is that that we have not, we have had, with just the lack of the lack of a visible population, I think has been one of our biggest barriers. And so that's the thing that autism had going for them, is an ability to have more systems identifying these kids. And so I really look at who's doing this well, and I guess that's probably not best practice, but it's a common sense approach, I guess, that has helped to kind of catapult us forward. And then to work closely with some of those organizations that we're all very aware of that have great reputations, like, the ARC and other community-based organizations like that.
Great, thank you. And we had somebody ask regarding the legislation requiring paraprofessionals who interact with children with an FASD to receive training. Does that involve classroom teachers and counselors? And what sort of training do they receive?
That's a great question. That's an example of low-hanging fruit. It does not include teachers and administrators and special ed teachers, although there is some legislation that, not this legislation, but there is some legislation that in fact supports, in Minnesota, requires teachers to have additional training when they get their relicensure on FASD. But the paraprofessional bill was some low-hanging fruit. We worked together with the Autism Society and the Brain Injury Alliance and said, let's do this, saying that you have to have disability-specific training if you are assigned to a child with this. And we just asked for paraprofessionals. The legislation just passed. Actually, it's just on its way to the governor's desk, and it's actually not passed yet, but it's in the bill. What we'll have to do now is, once the law is passed, that's when we start working with the Department of Education to actually create what that training will look like. That was not spelled out in the legislation, and oftentimes if you get too in the weeds and too much detail in legislation, it trips people up, and so we tend to keep things pretty specific and short, and then once it's passed, then you work with the appropriate department to help execute the legislation. So now, once it's passed, we'll start working with the Department of Education to design that training and to bring it to professionals across the state.
Great, thank you. And we have a question about what sort of work has been done or is left to do that is important as far as expanding alcohol screening, brief intervention for pregnant women?
Oh, I think that's absolutely one of the most important things that we all could be working on, and we're trying to figure that out, and I would love to have more conversations with more people, because mandating or requiring health professionals to do something seems to be a moving target, and so we have not figured that out. I do not at this point, we're not convinced that it's actually a legislative response, but perhaps it is a licensing board response. So we are now exploring what, who actually creates the policy that becomes requirements for frontline nurses and physicians that work with pregnant women. And so we're really learning, and we're really working with the OBGYN organizations here in Minnesota and other health professionals to really learn that. And so I think there's huge possibility, and I'd love to work with other states, and that's something we should work on a national level. But we haven't figured all of that out yet here in Minnesota, but it's definitely on our agenda.
Thank you. And we have a question asking, how does providing training on FASD to various audiences fit into advocacy?
I think that is the number one step, is providing training and education. I'm sure many of you have been talking to a room of teachers, or to a room full of students, or to a group of social workers, or to just people that are interested in the topic, and you start seeing the light bulbs go off. You start seeing people say, I had no idea that this was as big of an issue as it was. And then you start hearing the stories. You start saying, oh, this friend of mine adopted 2 kids from Russia, or oh, this, neighbor of mine, or my sister. And it's like, then you start hearing all of this. That's where the energy for advocacy starts. When you start igniting that awareness in people, and you start having people understand that this isn't someone else's issue, this is their issue. I think when you see people that are out engaged in big movements, it's because they have personally been touched or personally have been educated about this. And I think if we tell our story well, if we do a good job of educating all of those audiences that you're talking about, once you educate them, oftentimes there are many people within those audiences that are motivated to take the next step to make a difference. They say, what can I do to this isn't right, or more people should know about this. And that's an opportunity to say, would you like to become a part of our Speakers Bureau, or our advocacy network, or our advisory committee, or on our organizing board? So I think that that's an essential first step in really creating this mobilization that we would love to see happen.
Great, thank you. And one last question here before we conclude is regarding people that have passed statewide or local resolutions or proclamations. How can those measures be used in order to sort of take it to the next level as far as more legislative action?
I would say that's a great activity to do, to have local resolutions passed for FASD Awareness Month, for example. That's a great opportunity. And what I would say is, coupled with that, go and do that communications work. Write a letter to an editor, try and get on the local radio. And as you do that, plant the seed of like, this is fantastic that we are creating this awareness. And what I'd like to all draw your attention to is during our next legislative session, we're actually going to be working to introduce legislation that will do fill in the blank, whatever you decided is your priority. So I think creating resolutions and proclamations like that are really, really, really powerful, and use it as a communications and public relations tool to really drive with that goal in mind, identifying that goal of what you want to see happen, and then tether it. Because people say, oh, that's nice, it's FASD Awareness Month. But if you can tether it to an action step that people can actually do, it really makes those resolutions more meaningful. So that's a great idea. I kind of forgot about and that's something that you can do in your local community and get a lot of attention. Or you can oftentimes the governor will create, they have a way to create, FASD Awareness Day or a FASD resolution. So that's a great example and suggestion of something that you can take on and do with relative ease.
All right, great. Thank you. Well, thank you very much, Sarah. That was a great presentation, and we definitely encourage people to check out the NOFAS website for more information and for further, future webinars by going to www.nofas.org. And you can also follow NOFAS on social media, on Facebook and Twitter and YouTube to get more information. And the video recording of this webinar will be available within 24 hours on the NOFAS website and through the NOFAS social media pages. So thank you very much.
Thank you.